I'll begin by gathering my supplies and entering the patient's room. I'll close the door to ensure patient privacy. I'll introduce myself to the patient, verify the patient with 2 identifiers. I'll complete the 6 rights of medication administration and review the order with the patient. I'll then perform hand hygiene, complete a set of vitals, and make sure that the patient is on continuous pulse oximetry. I'll then assist the patient to a high Fowler's position and complete any tracheostomy tube suctioning if needed. I'll then perform hand hygiene and prepare my sterile field. I'm going to use this right here. Perform hand hygiene. And I'll open the tracheostomy kit away from me. Grab the sterile gloves, place them here, and only touching the shiny part and 1-inch margin of the sterile field. I'll grab that to set it up. There. Okay, then I'll take the contents of the kit, dump it to the middle of the sterile field, making sure not to touch, they don't touch the 1-inch margin or outer parts or contaminate anything. Then I'll fill this container with 50% hydrogen peroxide, 50% sterile normal saline, and these 2 containers of sterile normal saline. Then I'll perform hand hygiene and apply clean gloves. I'll remove any oxygen source if the patient is on any of it, and then I'll gently unclasp the inner cannula, stabilizing the tracheostomy tube while I unclasp. And following the curvature of the inner cannula, I'll gently pull backward to remove it, also while maintaining the stability of the tracheostomy tube. Then I'll place this inner cannula in the 50% hydrogen peroxide sterile normal saline mixture. In the real world, I would address this. For the purpose of this video, I'm just going to push the inner cannula fully submerged in the sterile normal saline hydrogen peroxide mixture. Then I'll gently remove the dressing while maintaining stability with the tracheostomy tube. I'll dispose of the dressing. Then I'll remove my gloves. Perform hand hygiene and apply sterile gloves. For the purpose of this video, I'm just going to move this so you can see my sterile field. Perform hand hygiene and sterile gloves. Only touching the margin. And with my dominant hand, I'm going to grab the inside of the cuff of the first glove and only touching the outside cuff. Slide onto my non-dominant hand, no rolling, nothing has touched my skin. With my gloved hand, I'm going to scoop with my fingers under the second cuff. And put on the sterile glove on my other hand. Again, there's no rolling. My gloves are on. I'm going to remove the sterile field with the gloves. Now this will be my clean hand. I will grab a brush with my clean hand from the sterile field and the inner cannula with my other hand, and I will thoroughly clean the inner cannula, dispose of this. Now I'll put the inner cannula in the sterile normal saline container. And get that, and then I will follow the curvature of the inner cannula and insert it into the trachea. And maintaining its stability, I'm going to reclasp. Now, with my clean hand, I'll grab the swab applicators and put them in the other sterile normal saline container. I'll use these cotton swabs to clean the skin and around the phalanges. If I notice any crusty secretions, I would use the applicators with the 50% normal saline, 50% sterile hydrogen, the sterile normal saline, 50% hydrogen peroxide. Applicator, clean the skin, toss, applicator, skin, toss, applicator, clean the skin and the phalanges, toss. Now I will grab a sterile gauze and dry the skin and the phalanges thoroughly. Making sure that the tracheostomy tube is stable. Dispose of that. Now I will grab a gauze to go be the new barrier for the tracheostomy. At this point, sterility is broken, so I will make sure I stabilize the tracheostomy and reapply the dressing. Now I'll remove the string by stabilizing the tracheostomy tube, untying it, and removing the strings, disposing of these. I'll then take the tie and with about 2 inches or so, I cut a hole in the center of that tie to use the 2-tie knot method. Go here. Also, if I had a second person, they would be stabilizing the tracheostomy tube while I reapplied the knots, or if the patient was comfortable and capable, I would also have them assist in stabilizing. Pull that. Now, because I made that hole in that section, I can use this part while stabilizing the tracheostomy to put the end towards that hole. Reapply, make a knot. Go around. Cut this part. Insert the string. Clamp. Again, the tracheostomy tube has been stabilized for this time. Next, away from the patient, I will tie the knot. The second tie. Making sure to tie it away from the patient and keeping the tracheostomy stable the entire time. After I've completed tying the knot, I would check to see the tightness of the string, making sure that the patient was comfortable. Then I would grab a 4x4 gauze, fold it, place it under the knot, and grab a piece of tape to tie to make sure that the knot is secured to the gauze and the gauze protects the patient's skin from the knot. After that's completed, I'll lower the bed to the lowest position. I'll remove any supplies. Remove my sterile gloves. Dispose of these. Dispose my supplies. Make sure that the patient is back in a comfortable position. Form hand hygiene. Make sure that the patient doesn't need anything else. And document the procedure.